Welcome to my presentation on Morocco. Since my group members are exempt from the final presentation, I will be presenting the section I was responsible for, which covers the country's size, income, politics, healthcare system, and stability as outlined in the rubric, but I also took the initiative to create PowerPoint slides for their sections. Here is my Morocco final presentation by Mariah Griffin for Dr. Cherry, PBH 320. Let's start with Morocco's geographical and cultural highlights. Located in North Africa, Morocco serves as a strategic link between Europe, Africa, and the Middle East. It is bordered by Algeria to the east and southeast, Western Sahara to the south, and has coastlines along both the Atlantic Ocean and the Mediterranean Sea, making it a key hub for trade and cultural exchange. Morocco has a population of about 37 million and spans an area of 710,850 square kilometers. Economically, it's a lower middle income country with a significant urban rural disparities. Culturally, Morocco blends Arab, Berber, and French influences, with Arabic and Berber as primary languages and French used in business and government. Islam shapes much of its traditions, holidays, and daily life, making Morocco unique. Let's now move on to its political system and healthcare landscape. Morocco is a constitutional monarchy with King Mohammed VI serving as the head of state. The government also includes a parliamentary system with elected representatives. The king's strong leadership and economic reforms promote stability, though challenges like regional inequalities and youth unemployment persist. In healthcare, Morocco has made progress, but disparities between urban and rural areas still remain severe. For example, urban centers have better access to cardiac rehabilitation programs, while rural areas often lack even basic facilities. Despite efforts to expand infrastructure, challenges in equitable healthcare access persist. Now let's look closer at coronary artery disease to understand how these disparities impact specific health outcomes. Now let's look at the nature of coronary artery disease. CAD affects blood vessels that supply the heart. It occurs when plaque buildup narrows the arteries, reducing blood flow. Symptoms range from mild chest pain and fatigue to severe cases like heart attacks. Treatments includes lifestyle changes such as a healthier diet and exercise, medical therapies like beta blockers, and invasive procedures like bypass surgery. For stable patients, moderate intensity aerobic activity is recommended for 30 to 60 minutes 5 days a week. While CAD is chronic, early diagnosis and consistent management improve outcomes. Now let's explore how CAD specifically affects Morocco. In Morocco, CAD is a leading cause of death, with cardiovascular diseases accounting for 38% of mortality. Rural populations face greater vulnerability due to limited access to healthcare. Socioeconomic factors like poverty worsen the problem, especially in underserved regions. Key risk factors include smoking, physical inactivity, and diets high in saturated fats. Gender and lifestyle differences also matter. Women often face higher risks due to cultural barriers to physical activity, while men are more affected by smoking and stress. With conditions like hypertension and diabetes on the rise, CAD is appearing earlier in life. Addressing these risk factors and improving healthcare access is essential to reducing this burden of CAD. Now, let's discuss its broader economic and social impacts. Coronary artery disease has significant economic and social consequences in Morocco. Economically, the disease strains healthcare resources, reduces workforce productivity, and leads to lost earnings. High mortality rates also reduce the labor force, impacting national output. Socially, CAD is linked to mental health challenges such as depression and anxiety, which are underreported due to limited mental health services. Rural areas are especially disadvantaged, with only 21% of physicians adequately distributed nationwide. Addressing these challenges requires targeted improvements in infrastructure and equitable access to care. Let's now explore solutions to combat CAD in Morocco. Addressing coronary artery disease in Morocco requires preventative and treatment focused strategies. One key initiative is a high school smoking cessation program modeled after France's Tabato initiative. Tobacco use is prevalent among young men, making this intervention crucial. Promoting healthier diets and physical activity is another priority. Public education on balanced nutrition and regular exercise can reduce risk factors significantly. Expanding access to healthcare, especially in rural areas, is also essential. For example, increasing cardiac rehabilitation programs can improve long term management of CAD. A national registry for CAD would help track the disease's prevalence and inform targeted policies. Together, these strategies can help reduce CAD's burden. Now let's consider the resources and policies needed to support these efforts. Combating CAD requires financial investments in healthcare infrastructure to improve access, particularly in underserved areas. Expanding cardiac rehabilitation programs and preventative services are also key priorities. Addressing staff shortages is also crucial. Training and distributing healthcare professionals more equitably can ensure effective treatment for all Moroccans. Public awareness campaigns about smoking cessation and healthy living can empower individuals to make better lifestyle choices. Finally, from a policy perspective, Morocco needs national regulations targeting CAD, such as mandates for smoking cessation and dietary improvements. Developing a national CAD registry will also enable data driven decision making. These resources and policies are vital for reducing CAD's impact in Morocco. In conclusion, coronary artery disease is a significant challenge for Morocco, driven by lifestyle factors like smoking, poor diet, and physical inactivity. Addressing CAD requires prevention focused strategies and improved access to healthcare. Investment in resources, trained professionals, public awareness, and national policies are essential for combating CAD. By taking a collective national approach, Morocco can reduce the prevalence of CAD, improve public health, and enhance economic productivity. Thank you for listening.